Good afternoon. I'm CEO of Lunit, Sobamsok. We have a motto of overcoming cancer through artificial intelligence. And before I briefly introduce my company, I would like to mention some background first. Throughout your life, you must have at least visited a hospital once. And at the actual field, I would like to mention here a patient would visit a hospital or a clinic and say, this part of my body hurts or I feel bad. Then the doctor would ask the symptoms and conduct tests. And if there is something wrong, then they conduct further tests like blood samples or radiology, and like image, among others, and they come up with a diagnosis and then conduct detailed studies and decide what kind of treatment would best suit the patient. So if you take a look at the entire process of this, it's a data based act. Of course, patients would um, make some like decisions or guesses, but based on this data, doctors would say, in this case, you probably have this disease, or this medication would best work, among others. So this is basically a data oriented decision process. But over the past a decade or two, there were a lot of technologies, and those developed technology are being applied. For example, CT or MRI, they did not exist about 2 decades ago, but nowadays we have this technology. So the medical standard itself has increased a lot, and the definition of conducting diagnosis has changed a lot, and of course, not to mention treatment. And recently, gene analysis, among other technologies, are being invented, and they are practiced in the medical field. And nowadays, the size and scale of data is getting bigger and bigger every day. So it's so big that it's really difficult for human beings, we people, to take a thorough look at every single piece of data. So because it's so broad and massive, even if no matter how well trained you are, what kind of specialist you are, using this big data to make a decision is really difficult. So in that sense, using the AI technology is really proper, and the AI is a very good fit because this big data is so massive and complex, and artificial intelligence is something that can properly analyze data pieces. So it's the most optimal technology. So I would say it will make a good fit. So in the past 5 to 8 years, there were various fields in the globe. There are a lot of startups launched their business in the medical healthcare field, and there are various new solutions, and their startups are developing them, and the entire market is growing a lot. So, based on that background, here comes Lunit. So, Lunit, we are focusing on cancer. So, I would basically introduce your company. We were founded in 2013, and we did grow a lot. And now, we have about 320 board members and a lot of staff members, and we have attracted a lot of investment, and we got a lot of like venture capital investments and strategic investors. So we have been keep growing, and of course we do have our headquarters in Korea, but we also have branches in the U.S. or China. So we are expanding globally as well, and this is the key characteristics and strength. And so in Korea, among the companies based on deep learning, we're number one, disregarding which field. So, in the very early stage, based on our specialty in artificial intelligence, we have been working on this. And World Economic Forum, for example, they said one of the best AI based companies. They announced it, and we were the only Korean company which was included in their list, and we went to a lot of competitions and competed over Microsoft, Google, among other countries, companies, and we won rewards as well. So one characteristic here is that we have a lot of strong medical staff members, and 12 medical specialists are working here full time. So they conduct various research, and they collect various data and refine data, and so they contribute a lot in this regard. And in Korea, Seoul National University, Severance Hospital, and Asan Samsung University Hospital, among other representative hospitals in Korea, are in collaboration, and also Stanford University in the United States is also collaborating with us. And not only are we developing products, but also what kind of significance do these clinical implications do these have? And studying that is also really important. And I personally was said we have been working very hard, and we have published over 100 theses and research paper. So we have a motto of overcoming cancer. That is our company goal. And especially in cancer diagnosis, we want to effectively diagnose cancer. So say those conventional diagnosis like techniques like OCT or chest X-ray, among others, we applied artificial intelligence technology on those conventional ones so that we can preemptively detect cancer. And the second one is in terms of treatment. What kind of cancer patients like, or get treated well from what kind of drugs? So our ultimate goal is we want to decrease the tumor's survival rate. So we began focusing on cancer because the healthcare industry is so broad, so we thought it would be impossible to be specialists in every field of healthcare. So we were asking ourselves, what would be our strengths? Then cancer is a very well-known and widespread disease. Of course, if you even in your personal between your friends or among your neighbors, there must be some cancer patients. So um, it's ranked number one or two in worldwide, the number of patients. And even in Korea, the reason for death, cancer accounts for one of the highest, right? So this cancer is very complex. For example, lung cancer, breast cancer, or stomach cancer, among others. People just use this simple term, cancer. But if you dive into it, there are dozens and hundreds and thousands of different types of cancer. That is why it is so difficult to treat cancer, because cancer is subcategorized into so many items. So so we thought, why don't we apply big data and AI here to analyze it? So that is why we're focusing on cancer. So in terms of diagnosis, what kind of business model we are adapting? Let's move on here. So we have two representative commercialized ones, which are lung cancer and breast cancer diagnosis X-ray technology here, and also which are lung cancer and breast cancer detection technology. So when we detect the cancer tumor is here, and we analyze the confidence level of this, so that those doctors who monitor this can be confident that there are tumors here. So based on the clinical research we conducted, we wanted to know the accuracy level of the artificial intelligence, and compared to even human specialists, AI showed a very relatively high accuracy. And what matters more is radiologists, when they used our technology, and we saw the how helpful it was, and their accuracy increased by 20%. So while there are very small micro tumors, but which humans find it difficult to detect, but AI can detect them. So even a very small part of tumor can be detected thanks to our AI technology. So I would like to show you an example. Here is a male aged 54. He was diagnosed with stage 3 lung cancer, and he at the same hospital he went to, he conducted an X-ray back in 2013 and 2014, but the X-ray said he did not have cancer, right? Because see, it's hard to detect. But when we applied this artificial intelligence back in 2013, even the picture, AI successfully detected a tumor from the 2013 photo. So if he had used this AI technology, then he would have detected cancer. Well, then he would have detected tumor at phase one, not three, which means he could have been uh, beginning treatment even some years ago. So that is our approach and our strategy. So while we began our business in Korea first, and in Korea domestically, about 10% of the entire image, cancer image, is conducted by our AI technology. And one the among the top 10 university hospitals in Korea, 7 out of 10 use our technology. And our initial goal, like should we go global or not? We spent a lot of time thinking about it. Of course, we do have our own technology, but we began to focus on collaborating with overseas companies as well to expand our market. So, based on that approach, we are in partnership with GE Healthcare, Fujifilm, Philips, among others, so that when they sell their equipment products, we developed our model so that it can be sold in a package. For example, if you purchase a laptop, there's Windows software inside of it, right? Just like that. So we embed our technology in their devices. So the strength here is that, say, we are software technology platform, so we do not have like hardware. So globally, it's really difficult to secure a channel, global channel. So seeking partnership with those hardware companies, equipment companies, is really helpful. So, and also in terms of brand recognition, it also helps us. And for hospitals perspectives, like it's compared to we are businessmen just visiting their hospital and trying to sell our software. And if you compare that to like they purchasing those conventional famous equipments, and if we have software in it, you can tell which is a better strategy. So globally, based on this partnership, we're working on our business expanding model, and currently in more than 30 countries, and like include like 600 or so hospitals from 30 or more countries are purchasing our technology, and they're actually using this technology at clinical trials, and the number of the hospitals and the countries will keep increase. And the next step is that we are focusing on preemptive early diagnosis as cancer, right? And like not only those imaging technology, conventional ones, and also those new technology, by collaborating the two, combining the two, and by coming up with a diagnosis model, and we should keep going toward the future. And last year, we conducted a partnership with United States Liquid Biopsys company. We got investment and um, signed a partnership. So likewise, we will keep contributing to this field. And next part is treating cancer. And in terms of treating cancer, since the cancer disease itself is really complicated, so one single drug cannot cure cancer. So there are different under subcategories. So you have to take multi um, sided approach. And what kind of biological traits or characteristics does the patient have? Here jumps in the biomarker. So, what kind of accurate technology can we take? Is the question. So, when you conduct a biopsy, here you can see these images. So, so far, when saying yes, this patient has a cancer or not, we use this technology, and there are a lot of like pieces of information about cancer, but since it's highly complex and complicated, it's really difficult for a person to accurately analyze this. But if you come up with this predictable image very well, and if you project or predict those reaction, then you can come up with good um, ways to treat this. And we are publishing a lot of like papers in international societies, like conferences. And in the past, people would say, this technology wouldn't show reaction, but we have proved that you can see reaction, and we figured out that we can detect increase the detection rate by 50% thanks to this new technology. So we're actually seeing fruitful results. So the next step is ultimately in this field, it is really important to collaborate with biopharmaceutical companies. So, like pharmacy or biomarkers, by pairing these two fields and coming up with a business model is really important. So that is what we are focusing on recently, and a lot of Korean companies and other international global companies, by seeking collaboration with those international companies. So we are planning to, of course, currently we're working on it, but later on in the near future, we will be able to pave a path to a successful development of this field. So, in terms of business, in terms of channel development, like I said, we do not have a physical hardware channel. So, if you take a look at those oncology specializing hospitals in the United States, if we collaborate with those hardware companies that have already paved a business channel with them, and if we seek a partnership with them, then it will help us. So as long as we get licensing, then we can massively expand our business to the United States, among others. So ultimately, no matter if it's testing, diagnosing, or treatment, or others, if you apply this technology to various fields under the category of cancer, then we will be able to detect and treat cancer, and we will, in the end, overcome cancer itself. That is our ultimate goal. Thank you for listening. Thank you.